Kit was my beautiful little boy who was born healthy but died when he was just 13 days old from the herpes virus, which he had contracted in hospital. Kit was born by emergency caesarean, and he had a bit of trouble regulating his blood sugar and temperature after birth, so he was admitted into special care. And we were reassured that this was pretty normal for emergency caesarean babies, and you know, he'd be out in a matter of days and it was nothing to worry about. He was given antibiotics, but again they said this was what happened to all babies, so not to worry. They weren't worried about an infection, it was just a precautionary measure. But eventually when he was like 6 days old, he was regular enough with feeding through a bottle, and his blood sugars were consistent enough that they were happy for him to be discharged down to the postnatal ward. We had a couple of days there because he started getting like symptoms of jaundice, but again, like, that seemed to sort itself out, and we were discharged on the 8th day. But one thing that we were concerned about during his whole time in the special care baby unit and on the postnatal ward was that he was very, very sleepy. So when the community midwife visited the next day, we kind of talked to her about our concerns that he was more yellow and showed her pictures and said about the sleepiness. And she said, like, oh, he seems like a healthy baby, but you're right, he is a little bit yellow. So if I were you, I'd take him into the children's hospital, and you need to do that quite quickly, because if it is jaundice, which is what she was concerned about, it needs to be addressed quite quickly. So we took him back in, but when we got to the children's hospital, the doctors there were already much more concerned than the midwife was, and they suspected he had an infection based on what we told them about his sleepiness, the fact that he wasn't feeding. And they admitted him there, and quite soon escalated his care, because the observations that they were making was that he was a very sick baby. So at this time he'd been on antibiotics his whole time in the special care baby unit, but they put him on more antibiotics, assuming that it was a bacterial infection. However, Kit got steadily worse and worse, until he was at the point where he was having seizures, very, very floppy, quite waxy, and they just weren't happy at all with how he was. And lots of things were mentioned, so, you know, the bacterial infection that I've mentioned, metabolic conditions were considered, but at no point at all was the herpes virus considered, which turned out to be what Kit had. He had neonatal herpes. So yeah, he was just getting worse and worse until eventually he was put in an induced coma and taken by ambulance to the Evelina Hospital in London, and we followed shortly after. And we arrived to find Kit they were just trying to save his life by that point, so he was swollen, bleeding, connected to all kinds of tubes. They'd started treatments such as giving him adrenaline shots, blood transfusions. When we first got there, the doctor asked myself and my partner, had we had cold sores recently? The answer was no, I'd never had one, and my partner hadn't had one for years. But there was something in how Kit presented at that stage that made the doctor there suspect neonatal herpes. But by that stage it was just too late to save him, and it ended with the doctors there performing CPR on Kit while we watched absolutely helpless. And the tests the very next day confirmed that he had the herpes virus, HSV1, but it was never tested for when he was alive, and it wasn't treated for when he was alive. So Kit had no chance against this infection, which ended up taking over his entire body. So there are 3 areas of advice that we would like healthcare professionals to take away from this film. The first is for anyone coming into contact with a newborn baby, and that is to not work clinically if you have a cold sore. So no cold sores should be seen on postnatal wards, in special care baby units, on labour wards. And it's just so easy to absent-mindedly touch a cold sore, touch a baby, and that could be it for that baby. That baby could die as a result of that simple action. So we urge all hospitals to adopt that policy. And we know many already do, which is fantastic, but we also know that many do not have such a policy. So we want all trusts across the country to adopt that policy. Secondly, mainly to midwives and healthcare visitors, is make sure you ask the pregnant woman about her herpes history. And that's not just when you're going through a quick tick sheet STD question mark. You need to ask, have you ever had herpes? If the answer is yes or no, you need to give advice accordingly. So yes, you need to consider antiviral medication. No, you need to let them know that if they should experience any symptoms at all of genital herpes, they need to let you know as a matter of urgency. And you need to tell them that that can be very dangerous for their baby. So one of the issues around neonatal herpes is the stigma around herpes in general. So what we really want midwives to do is to make sure that their mums are very open to talking about any history of herpes. And the third bit of advice is for doctors who are looking after sick babies, and that is just to have a very high index of suspicion for neonatal herpes. So really consider it in all babies you see. Only a few of the babies that have the herpes virus actually present with the rashes or lesions that you might expect. So don't always assume it's an infection that needs antibiotic treatment. It may well need that antiviral treatment. And we'd urge professionals to, administer antivirals at the earliest opportunity if HSV is suspected.